Mhm. So you can do that. Yeah, that's what I told Gary. I said, oh my.
All right, good afternoon, everybody. My name is Allison Kelly, and I am your primary point of contact for this grant. I'm glad to see everybody here today. It looks like we've got about 31 people so far on the line. I would just ask a couple housekeeping things before we get started. First, if you could please put your device on mute, and then that way everybody has an opportunity to hear, and we won't have any feedback or anything like that on the line. The other thing is that this is also an opportunity to ask your questions, but we would ask, given that we have quite a number of people on the meeting today, that you submit your questions via the chat function. And Mark is here, and he's going to be helping me toward the end of the presentation with answering, those questions as they've come in. So my goal today would be to try to get to as many questions that have come in so far within the presentation. But certainly we recognize that there's also going to be questions that come up later. So if those come up for you while you are on the presentation, please do let me know and put those in the chat, and we will do our very best to try to answer them today. And if we can't answer them today, I did want to let you know that we're going to have a frequently asked questions document posted to the website under the members portal, and you can access that. If you don't have access to the members portal, Mark can certainly help you with that. But all of that will be posted there. We do have, it's probably going to be posted later in the day today, possibly even tomorrow morning. And it will reflect the questions that came in from the webinar yesterday, the questions from today's webinar may not get posted on that until tomorrow. So just a heads up about that. But we are going to post this presentation as well, a recording of this presentation, as well as the presentation itself on the members portal. So you have access to that. There's a lot of other documents posted there for this particular grant too. So that's a helpful place to look if you need any of the documents. So, all right, let's see here. So I want to thank everybody that has submitted questions so far. It's been incredibly helpful to put this presentation together, you know, that and including your questions in that. First and foremost, and everybody has asked some really great questions, and so we're very thankful for your time and effort in putting those questions into us so that we can make sure that this hour is the best use of your time. All right, so there may be situations that come up, especially with questions. There may be some that are unique to your organization, and in those particular cases, we're just going to ask that maybe we address those questions offline, given that it's probably something that may not necessarily apply to a lot of the other organizations that are on the line. So just a heads up about that. And with that, we will go ahead and get started. Mark, can you see my screen share up? Hopefully everybody can see the NCPRO member guidelines page up here. All right, I'm going to assume that that's a yes.
Yes. Sorry.
That's okay. Thank you, Mark. I figured you were on mute. No worries. Okay, so the first thing I want to say is that this particular state appropriation is really a historic moment for the association and its membership. And so we're just really appreciative of everybody's input on this. We're appreciative of the questions that you've all posed to us. We're appreciative for all of you as members, the board, and certainly the staff that has really helped to clarify questions along the way, and really advocate for this organization and for all of you. So we're just really thankful that we're here in this place. It's been a lot of hard work leading up until this point. There'll be a lot of hard work even after this point, but this is a pretty historic moment. So we're very happy and thankful for that. So we're gonna dive into some specifics here. So just before we move on, I do wanna just remind everybody that the deadline to opt in is tomorrow, the 17th. So please let us know. We're going to talk about some more specifics about what opting in really means, but that deadline is tomorrow. So just a quick heads up about that. All right, so diving in here to the details, a lot of this language you guys have already seen, so I'm not going to go into too much. We have a lot of other very detailed information to provide to you today, so I'm not going to go into the specifics with the language in the appropriation bill, but I am going to say that as an organization, we have been appropriated 425 million for eligible health services that are provided during the COVID-19 emergency. These are federal funds, and therefore they come with federal restrictions. So that's really kind of the main gist of this particular slide. I think I mentioned this already, but do submit your questions through the chat function. We're going to be collecting those as we go and address anything afterward that is not addressed during the presentation. All right, so there are laws that govern the use of the funds that we have been appropriated. That includes the CARES Act, the federal law, as well as two particular laws from the North Carolina General Assembly. And so I'm not going to go into too many details with this other than to say that these are the laws that govern the use of the funds. All right, so as you see here, the CARES Act is very specific in saying that the funding needs to be used for necessary expenditures that are as a result of the public health emergency created by coronavirus or COVID-19. And you'll see that the time period, and I want to point this out because the time period is actually for expenses is between March 1st of 2020 and December 30th of 2020. So keep that in mind. It's December 30th, and that I wanted to point that out because that could be easily mistaken for another date. So December 30th. And again, because these are federal funds and they are, governed by the CARES Act, this grant really is fairly restrictive. And so we're going to talk about what some of those restrictions are today, but just know that the use of the funds is actually subject to audit by the Office of State Budget and Management. And so that's an important detail. All right, this is the state, how the state law was written. Again, I'm not going to go into detail about this, but it's very similar to what you saw on the other slide. This is important. So I do want to make the point that, you know, we recognize that there may be some clinics who are not in a position to to utilize the full allocation that has been given to your clinic. And that is okay. If that happens, that's okay. What we're asking is that if you can use, you know, at least half of it or even a majority of it, please do opt in. And the reason for that is because you're not obligated to spend that full allocation. We always can redistribute funds among the organization but among the membership rather, if we need to. So we can always, if you're not on track at a certain point in sort of the fall, late fall, we're gonna, you know, do a little bit of shuffling around. And so don't, you know, feel pressure that if you can't spend your entire allocation, we can certainly use that. Our goal is to use all of the funding, but certainly if your individual clinic cannot use all the funding allocated to you, we would still love for you to opt in anyway. So we'll talk a little bit about more about what that means, but keep that in mind. Okay, so let's talk about restrictions. We'll start off with that just so that everybody's on the same page of how it can and can't be used. So federal law designates how the funding can be used. If the use of the funds is deemed to be disallowed, then we actually do have to return the money to the Office of State Budget and Management. Our goal is that that will not happen. So the guidelines that we're going to give you today are designed to ensure that your clinic and that our organization do not have to return any funding. So that's you know, why the guidelines that we've created are designed the way that they're designed, is to keep you guys in compliance and keep you safe from having to do that. Do know that interest earned on the fund actually also has to be used per the agreement. So if that situation applies to your clinic, just know that any interest does have to be used in that manner. And the law is very clear that this funding cannot be used for revenue replacement or even reimbursement for donated services. And the funds any funds that are unspent, and again, I mentioned that our goal is not to have any unspent funds, but if there are, those all have to be returned no later than January 30th of next year. All right, we've had a lot of questions come in via email about this, and I hope that we can provide some specific details here for you today. So you have probably seen this list before. This list was included in my original grant email to you. It is a really important point, and so we want to kind of dive into some details here. So duplication of benefits is not allowed in any sense with this grant. So so in other words, all expenses applied to this grant cannot be covered by any other funding source, even if you don't see it necessarily on this list. So if any other funding source comes into play, that it is not an eligible expense for this particular grant. Now that's not to say that portions of, so if you have grants or other funding sources that cover portions of, in particular staff expenses, you may use this grant to cover the other portion that's not covered by you know, any other grant or funding source. So that is allowed. If it's a portion that's not covered by anything else, you may do that. But you know, again, we just have to be really careful about the potential for duplication of benefits. So that includes things like Medicare, any kind of third party, you know, reimbursement like Medicare, Medicaid, TRICARE, insurance. If you receive those particular reimbursements, though, you know, if you are applying staff expenses to the grant, you would need to pull those out. So those would need to be backed out of whatever you're applying to the grant. So keep that in mind. A lot of clinics have gotten PPP loans. So an example of how, you know, a PPP loan could be managed with this particular grant is, let's say, for instance, your PPP loan covered the months of May and June. for your staff expenditures, you could theoretically use this grant to cover March, April, and then skip May and June, and then start again in July, and apply the funding from, or the staff expenses from July forward to this grant. So, and patient payments. So some clinics have a standard kind of $20 fee for visits. If you're, again, if you are applying your staff expenses to the grant, then those payments would need to be backed out of that. And then the community health grants, this one has actually come up a lot. And the situation with the community health grants is, again, you know, if that grant is covering your staff expenses, then you would not be able to apply those same expenses to this grant. If it covers a percentage, so let's say your community health grant covers 75% of your staff expenses, eligible staff expenses, then this grant could cover the other 25% of those eligible staff expenses. And then any other funding that's come in that may somehow make its way to your clinic that's part of the coronavirus relief fund, again, we need to be careful about making sure that those are not also expensed to this grant. An example would be one of the clinics has shared that their city is giving them funds from the coronavirus relief fund to renovate their lobby. And so obviously any expenses related to that have already been paid for through the coronavirus relief fund and would not be eligible under this grant. All right, let me make sure that we've covered everything related to this particular slide. Oh, the other thing I want to say is that even if, you know, if any of these apply to your organization, it doesn't mean that you're not eligible to participate in the grant. It just means that you need to be careful about which expenses you do apply, so that they are not expenses that were covered by any of these funding sources. So you are still eligible for the grant if you have any of these types of situations. All right, so in terms of defining eligibility, again, the time period applies. Your expense needs to occur between March 1st and December 30th of this year. It can't be reimbursed by any other funding source. It has to be defined as an eligible expenditure, and it also needs to be backed up by documentation demonstrating that it's an eligible expenditure. So you'll notice in your grant agreement that there are many categories of expenses that are eligible. And so we're going to talk through each of these today. You will notice in the grant notification email that I recommended, and that we as an organization recommended, that you really try to focus as much as possible on employee expenses. I'm going to talk about why we're making that recommendation, but we will cover other categories of potential, you know, eligible expenses. So I did want to make that clear, that those other expenses are things potentially that could be used. We certainly want to have a conversation about any of these, though, if you choose to use something beyond employee expenses. So let's make sure that we talk through that and ensure that you're going to be compliant if you choose one of those other categories. Oh, I'm going to back up one second. The other thing I want to point out here is that the important thing to keep in mind is that any expenses need to be tied to COVID-19. So when we're looking at each of these categories, you're going to notice that we talk a lot about that they all have to be related to COVID-19. All right, so I just mentioned that we really are recommending that you leverage the grant in the most compliant and streamlined manner. And what we have learned as we've gone along in terms of the documentation required, that employee expenses for your organizations, you know, focusing on those employee expenses and using that to apply to the grant, to use your allocation, is going to be the most streamlined way of using the funding. It's going to, you know, definitely reduce the amount of documentation and paperwork that you need to submit with your reporting, and it's going to be a lot more streamlined, straightforward, and there won't be as many questions potentially that could be raised from the use of the funds in this manner. So I want to point that out because that's the reason that we, you know, have made this particular recommendation. So again, if you choose another category, please do discuss with me prior to submitting your budget and prior to submitting certainly any monthly reports for reimbursement. Okay. Actually, I'm sorry, I'm going to back up on this slide one second here, because what I want to tell you is that you'll notice on attachment A2 of your grant documents, this is the budget document, you'll notice that when we sent that to you, that we actually pre-populated the staff expenses category with your full allocation amount. Again, if you choose to segment some of that out into other approved categories, then you can certainly do that. But you need to, you'll need to do that at the time of your budget submission to us. So again, just keep that in mind. That might need to change a little bit if you choose to use another category. I think one example of that would be, if some of your staff expenses are used for 1099 contractors, then you would need to separate out that staff expense from employee expenses over to contracted labor expenses. That would be an example of one of those areas that would need to change on that document. Okay, so when we talk about employee expenses, we're talking about payroll and benefits costs. And we do have a distinction between two types of employees. So we're talking, you've heard us talk about credentialed clinical employees, and then there's certainly, other staff that you have that are either in administrative or support roles. We're going to talk about the difference between those two. But what I want to point out to you is that the U.S. Treasury frequently asked questions for the CARES Act actually designated free and charitable clinics employees as public health employees, and therefore substantially dedicated to mitigating or responding to COVID-19. Now, they did specifically designate that these are healthcare employees and public health employees that are considered substantially dedicated. The Governor Cooper's executive order that we included in your initial grant email also, that executive order number 143 also paved the way for the designation of your credentialed clinical staff to fall into this category of public health workers that are responding to COVID-19. So that was a really important legislation for us. So again, we're really encouraging the most conservative approach when it comes to which payroll expenses to submit for reimbursement. So we're really asking, if at all possible, please focus first on submitting the payroll expenses for, and that would include salary and benefits for any credentialed clinical staff first at your organization. And now when we talk about staff, we're talking about, existing staff, but we're also talking about new staff. So if you need to bring new staff on, that's certainly okay with this grant. But when we talk about credentialed clinical staff members, we're talking about those folks that are qualified by education and training, they're credentialed or have some kind of a licensure or registration or certification, and they have a scope of practice for their professional responsibilities. So the important thing here is because they have been designated as substantially dedicated, their payroll is covered at 100%, assuming it's not covered by some other funding source. So for the purposes of this grant, those folks would be covered, their salary and benefits would be covered at 100% under the grant. And there's a lot less documentation that you need to provide, and we'll talk about what that is, but essentially we just need payroll records for these folks. So that makes your life a lot easier when you're reporting each month. All right, so this is probably the slide that everybody's been waiting on. Who are the credentialed clinical staff, and what are the categories that these folks fall into? So you'll see it's many of the clinical roles that you have at your clinic. We have a listing of these roles that have been posted to the member portal, and there's a whole list of these. This is just page 1. We also have page 2, which has pharmacy staff, a lot of the credentialed pharmacy staff and behavioral health and dental clinic staff that are credentialed. So, so we've got that list on the member portal. These are the folks that their payroll and benefits, as long as they're not covered by some other funding source, they can be, cover 100% under this particular grant. All right. This is a really important slide. And so I just want to call everybody's attention to this. I also want to call attention to the fact that if I had a conversation with your clinic before Tuesday, then this is new. So up until Tuesday, we had understood that there were certain restrictions around administrative staff and even non-clinical support staff and how much of their pay could be applied to this grant. It has changed because on Tuesday afternoon, we actually got some clarification from the Office of State Budget and Management specifically about these roles. And a lot of that was because of the questions that you all posed and your concerns that there was some limitations at that time, at least related to this. So I do want to point this out. This is really important. So overall, the legislation really, at least according to Office of State Budget and Management, they don't consider administrative employees to be substantially dedicated. So that's an important distinction. But it doesn't mean that you can't apply some of these folks' payroll to the grant. So the deal is with this is that you have to be able to demonstrate by timekeeping records that they are involved in some way in COVID-19 related activities. So you can apply the payroll for these folks to the grant, but you're going to have to submit timekeeping records that specifically show how much time, either by hours or the % of time that they're engaged in COVID-19 related activities. So it may be it may be a portion of their time. So for instance, maybe you have a clinical support person that is spending, an example might be a medical receptionist, and maybe your medical receptionist is responsible for every single person who comes into the clinic. They're asking those screening questions about, do you have fever? Have you been around anybody who's been exposed? Whatever portion of the time that they spent doing those screening questions that are directly related to COVID-19, that portion of their time can be expensed to the grant. So that portion of their payroll can be expensed to the grant. And if you need to hire new administrative staff to handle any of the COVID-19 administrative functions, you can actually if the 100% of their payroll actually can be applied to the grant. So if they're 100% of their time is spent on COVID-19 activities, then you can definitely apply those folks to their payroll to the grant. All right. Another example, just if this is helpful, and if it's a situation that happens at your clinic, we had a clinic ask about interpretation staff, so interpreters that work with the providers, and they are in on most of the clinical visits with those folks, since that if they're needing to provide those services. So those individuals, the time they spent with those providers providing those services would be something that could be covered under this particular grant. So just keep in mind that, the timekeeping records are really the key here. We have to be able to see those timekeeping records for anyone who is not a credentialed clinical employee. When you're looking at this, it's really important to focus on the role that person is engaged in at your organization, not necessarily the person's credentials themselves. So for instance, we have, maybe an executive director is an RN, but really 100% of their time is administrative. So in that case, they would not be considered substantially dedicated, and they're not spending any portion of their time perhaps on COVID-19 activities, and so then their payroll would not be eligible for this fund. But if they are spending a portion, which we suspect a lot of folks are, if they are spending a portion of their time, so we have somebody who sounds like they're maybe not on mute. If you could just check your mute button and make sure so everybody can hear, please. Thank you. All right, so if that individual though does spend any portion of time on their COVID-19 activities, then that specific portion of time could be applied to the grant. But again, we would need those timekeeping records to demonstrate that. And then certainly, it may not be, we may not be expensing necessarily 100% of somebody's pay. So portions of their pay are certainly acceptable as long as they're not reimbursed by any other funding source. All right, so when we're talking about employee expenses, for all employees whose payroll and benefits you apply to the grant, we do need payroll records to back that up. And we also need for any staff who is not credentialed clinical staff that you're applying to the grant, we need timekeeping records as well. So that those records must demonstrate the amount of time or the percentage of time that that person spent on COVID-19 activities. So each month you're going to submit that, those records along with your attachment C1 and C2, which the attachment C1 is your monthly progress report, and then your C2 is the reimbursement request. So we'll talk about the monthly reporting timelines, but just know that your first payment will actually come in probably mid-August, because the first reporting period is going to be August 10th as a deadline for that. And then whatever amount you have expensed to the grant at that point that is allowed, we'll reimburse you for that shortly thereafter. Okay, so contract labor employees, or excuse me, contracted labor expenses. This would be for, you know, if you have individuals who contribute to your clinic as independent contractors, and as long as their payroll records, or excuse me, their payroll expenses are demonstrated as eligible, then you can apply those to the grant. It could also be temporary contract workers. Again, as long as they're designated as eligible expenses, their payroll could be applied to the grant too. It may be that maybe your clinic has had some sort of a COVID exposure, and you've had to have a cleaning service come in and disinfect and do, you know, a significant deep clean. Those can be expensive. And so if you've had that situation, or you have that situation in the future, then that cost of labor for that can be applied to the grant. If you've had to do any kind of upfitting, retrofitting of your, you know, clinic space to accommodate social distancing or infection control, you can certainly apply those expenses to the grant as well. So in this case, again, you know, there needs to be, for the employees or the contract employees, you need their payroll records. If they're not substantially dedicated, those credentialed clinical folks, then we do need those timekeeping records as well. And then if it's any kind of construction type labor, then the payroll, or, you know, the invoices would be required for that. And then again, from a reporting standpoint, monthly, those invoices or payroll records would need to come in with attachment C1 and C2 in order to receive reimbursement. All right, so you'll notice in your grant agreement that other service expenses, and they define those as things like utilities, telephone, you know, data, lease kind of related expenses. We don't really expect this category to be utilized. It's going to be really hard to show that those particular expenses are directly related to COVID-19. So we're really just asking that, you know, you not focus on this particular category. If something comes up for your clinic though, and you do feel like it's related to COVID-19, then let's have a conversation about it before you submit your budget, or certainly before you submit any reimbursement requests for those. And your contract agreement also talks about subcontracting, and we don't really anticipate that that's going to come into play. But if it does, potentially, then you know, just know that your grant agreement actually defines the terms of any kind of sub recipient, which is what that situation would look like. So just refer to your grant agreement for that. But again, let's have a conversation if you're anticipating that. But we really are not. I mean, this is that could be a kind of a complex situation. So, all right, goods expenses is another area that's defined in your agreement. We're really looking at goods that are specifically related to COVID-19. So things like COVID-19 testing supplies, any kind of cleaning, you know, sanitizing supplies, personal protective equipment. So these are the examples that we've seen so far. I have had a couple conversations with people about other things like, you know, and it kind of falls into these categories, but like hand sanitizing stations maybe that are outside, or hand washing stations that are distributed throughout the clinic for folks. So those types of things are acceptable too. So again, when it comes to submitting your reimbursement request for those on a monthly basis, we need the invoices for those goods. And again, we need to be able to show that they're related to COVID-19 in some way. All right, equipment expenses. We've had a lot of questions about equipment, and again, we really want to make sure that we're compliant in how we use funds for equipment expenses. So the areas that we've seen that are allowable expenses have to do with equipment that enables telemedicine capabilities for COVID-19, or even maybe laboratory equipment for COVID-19. But you'll notice that all of these things have a direct connection to COVID-19. So if this is an area that would be beneficial to your staff, or excuse me, to your clinic, then you know, if you are anticipating that type of purchase, then you know, just let's have a conversation about it. And that when you're reporting, you're going to need to submit the invoices for the purchase of that equipment along with C1 and C2. And then other expenses, this is sort of the catch-all category. We don't really expect much to be put into this category. So again, if there's something that you think falls into that category, let's have a conversation about it. Okay, so we're going to move on to reporting requirements. We do require, or OSBM requires monthly reporting. So we actually have timelines for when we need to report, and so therefore there's also timelines for when the clinics need to report. So you know, we will, as I mentioned previously, we will reimburse your organization from your allocation with complete and accurate monthly reporting. You know, the first reporting deadline is actually going to be August 10th, and that's going to cover, just a heads up, that's going to cover a longer period of time. So it's going to cover from March 1st through July 31st. So your first reimbursement probably will be rather large related to future reimbursements because it does cover that first 5-month period of the grant. And then each month on the 10th of the month, your reporting from the previous month is going to be due. So if we have questions about anything that you've submitted, we really need you to respond promptly. In fact, we need, you know, definitely a response within 3 calendar days at a maximum, because we have to turn this stuff around to SBM very quickly. And so if there's any information or clarification needed, we really need you guys to respond quickly to that. So keep that in mind, that that's something that's actually designated in your grant agreement. And then when we get all of your reimbursement requests, the attachment C1 and C2, we're going to submit that on your behalf to the Office of State Budget and Management through their NCPRO portal. And keep in mind that the reporting that you're doing, you need to try to capture all expenses in that particular reporting period. We're not going to be able to go back and capture expenses from a previous reporting period. So we need to make sure we capture everything at the time that period is due. And the other thing is that you might find, your clinic might find itself in a situation where you've exhausted your entire allocation, maybe say by October. Please continue to report though, because even if you've got additional expenses, it may be that when we do the redistribution later, if we have clinics that are not using all their funding, then we might be able to apply some of that to reimbursements that are needed for your clinic. So I know that's not an ideal situation for a clinic that, you know, isn't using all of their funding, but again, the goal is to use all of the funding. And so if we need to do that redistribution, we can, but we also need to know how much you guys are needing that. So each month you're going to have to submit your attachment C1, attachment C2, and then all the supporting documentation for that. For those particular reports, which of course would be payroll records, benefits records, and certainly timekeeping records if that applies to the expenses that you're submitting for, and then any invoices that would apply as well. So this is your attachment C1, which is your monthly project status report. You'll notice in the narrative at the top that we're asking for certain additional details in the reporting on this form, and that is we want to capture, and this is more from an outcome standpoint, we want to capture the total number of patients that your organization has served during that time period, whatever that reporting period is. And we want to see the breakdown too of the number of new patients served versus the number of existing patients served, as well as the number of COVID-19 patients specifically served during that particular time period. So again, your first reporting period will be that 5-month reporting period, so it'll be a little bit longer than all the other ones. And then after you opt in to the grant, I will provide your organization with a contract agreement number, which looks similar to the one that's on this form, 32-00-01. You'll be assigned a number that the last 2 digits of that number will be unique to your clinic. I'll plan to update all of your submission documents with that number, but in the future for your monthly status reports, we will need you to enter that number on all of your reports, so keep that in mind. And then other than that, I think the form is pretty straightforward, but if you have any questions, do let me know. And then this is your monthly reimbursement request, which is attachment C2. And this is where you're gonna dive down into the details of each individual expense that's being applied to the grant for that period. So if it's an employee expense, you're going to be providing that employee's name, their title, the number of hours that they worked, or their total payroll for that period. If it's another type of expense, then certainly we'll need all of the records to support everything that you've designated on here, like payroll records, like benefits records, invoices, etc. All right, and this is our timeline. So this is kind of, you're getting a bird's eye view here of the life of the grant and the different time periods that we're looking at. So certainly we're here in the week of July 13th with our webinars. Tomorrow represents the opt-in, opt-out deadline. Next week, we're actually going to do a redistribution of the funding. And we're going to do that because we do have some clinics who are going to opt out, who have opted out or are going to opt out of participation. And so the funding that was allocated to their clinics will be sent back through the funding methodology and reallocated. So that will occur late next week. Now, many of your clinics have asked about a few of the forms that are a little more challenging to complete this week, like the no tax delinquency certification or getting your DUNS number, and you've asked whether you can have an extension on that particular form. I'm completely fine with that. I do need to have all of that in no later than the close of business next Wednesday, which I think is the 22nd. So I do need you to opt in still by tomorrow. I need all of your grant agreements that you can provide by tomorrow, but if there's a form that perhaps you can't for some reason provide by the deadline, then I can certainly make an extension into next week for that specific form. And then once we get through all of the grant opt-ins, opt-outs, then we come up to our first reporting period again, which covers that first 5-month period, and then every month thereafter. You'll see that we've designated a potential redistribution in late October at some point, and that's again if funds are not fully being utilized by the clinics who've been allocated those funds. And then our final outcomes are due on January 10th. And the attachment F, which you received in your packet, is the form that you'll use for that final report. And if you still have reimbursement requests at that point that you need to submit, then you'll also submit that along with your attachment C2. And then, again, we don't anticipate the return of any unused funds, but if that happens, then we'll need to do that as well at that time period. So to talk a little bit about opting in, I want to just review really quickly the documents that you're going to need to submit for an opt-in, and that's going to be a signed grant agreement. And then check your instructions that I sent you, because there's specific things, areas you need to fill out on that grant agreement. If it's easier to submit a PDF copy of that, that is absolutely fine. Attachment A1 is your scope of work. We need that as well. Luckily though, you don't have to do anything with that other than fill in your organization name and the end of your fiscal year. So please don't change the scope of work section, that narrative section, because we want to make sure that that stays consistent across the entire membership. So you don't really need to do much else other than fill in that top portion. Attachment A2 is your budget. Again, we want to be able to see where you're projecting your spending over the life of the grant. It has already been designated, you know, in your employee expenses category, your full allocation was put there. If you're going to divide anything out, if we've not already had a conversation about it, let's do that. And then you would divide those different projected amounts among those categories at the time that you submit it. One thing that I think is important to mention is that, and I didn't mention this yesterday in the webinar, and so we're going to get this information out to everybody, but if for some reason your clinic thinks you're not going to use the entire allocation, let's leave the full allocation on your attachment A2, because when we submit all of the attachment A2s, it needs to total to the $7.425 million that's been, you know, designated or appropriated for the organization. So if you end up not spending it, it's certainly fine. We'll deal with that at a later time. But if you would please not change that amount that's been allocated to your clinic, of course, unless you're, you know, choosing to opt out. And then you'll need to submit attachment D, which is the no tax delinquencies. Keep in mind that needs to be notarized, and it needs to be current as well. So several folks have asked if they could submit old ones, and we need current ones actually on that one. And then attachment E is where you're going to put your DUNS number, and there's a couple questions on that one that your clinic needs to answer, and your conflict of interest policy. If you would like to adopt the conflict of interest policy that we provided to you, you're more than welcome to do that, but you don't have to do that. So if you have your own conflict of interest policy, you can certainly use it. The only thing I want to say about the one that we sent you is it was designed specifically for the requirements with state contracts. So that can be helpful to you if you choose to adopt that one, but you certainly don't have to if you already have one. If your organization chooses to opt out, ultimately, we hope that you don't, but if you choose to, for whatever reason, if you could just please, you know, send me an email so that we can have documentation of why you've chosen to opt out. That would be really helpful in terms of the due diligence requirements that we have around that. All right, so here is my contact information. I would love to speak with you. I do have, today has been a day where we have been trying to get frequently asked questions addressed and documented, and we're going to try to get those up to the website as soon as possible. So I have several emails that are sitting here in my inbox over the last few hours that I have not yet addressed, and I'm going to get to those this afternoon. So if you've sent me something this afternoon and I have not responded, I will do my very best to try to get to those before the end of the day today. And I think I've even got a couple voicemails here as well. So I'm going to do my best to get back to everybody on those questions. So if you're waiting on an answer, rest assured I will do my best to answer it for you. All right, before we jump into questions that have come in from the chat, I did want to address a few questions that have come up recently. I think that we've also probably addressed these within our frequently asked questions, but maybe important to kind of bring up here. So there was a question yesterday about if COVID-19 was not designated on timesheets before before now, could your clinic go back and you know, create a column for COVID-19 or some way to designate time spent on COVID-19 activities? You can go back and provide a recategorization of that information as sort of an amendment. So keep that in mind, that if you need to do that, you certainly can do that. If you're, we had a question come in as to whether a separate bank account was needed for this funding, and you don't need a separate bank account as long as your accounting software, you know, keeps it separate from everything else. That's absolutely fine. You don't need a separate bank account. And another question that has come up that I think is an important one to talk about is, we've had some questions come up about whether visit expenses can be applied to the grant, patient visit expenses. And so the deal with that is that if you're if you're applying staff expenses to the grant, you can't also apply patient visit expenses to the grant, because that would be a double dipping situation, because the provider's time is accounted for in that visit expense. So again, that's one of the reasons why we've kind of, tried to sort of guide everybody in the direction of those staff expenses, because it's a lot cleaner. And so I did want to talk a little bit about that. All right, so we've got about 15 minutes left before the top of the hour. I think it's a good time to for Mark, you to come on and talk about some questions that have come in through the chat, and we'll do our best to try to answer them today. Some of them we may not be able to answer today, and we may need to get back to you on it, or it may be something that we address during the frequently asked questions, but we'll do our best with that. So Mark's going to bring up any of the questions then that have not yet been addressed and that are, sort of unique and that we have not received yet or have not been addressed in the presentation.
All right, well, some of this has been addressed, but I think it's worth revisiting just so they have clarification. It's all around the staffing. So specific examples that came in are health educators, eligibility personnel, custodians who clean the showers in the facility itself, care managers and social workers, the admin staff that work for them, and then medical assistants and coordinators that don't have credentialing. And I think a lot of that is included in the FAQ, so I thought you might just want to real quickly address that as well.
Yeah, great question. So yes, so those all appear to be roles that are not the credentialed clinical staff roles that we have said are substantially dedicated. And so for each of the roles, Mark, that you mentioned and that were asked about, health educators, eligibility personnel, care managers, administrative staff, support staff, any of those types of roles, it's the responsibility of your clinic to designate the amount of time that they are spending on COVID-19 related activities. And so that once that time is designated on their timesheet, then it is then eligible to be applied to the grant.
What is your interpretation for custodian?
That specific category?
Mm-hmm. Yes.
Let me get back to everybody on that one. I'm not sure.
Okay.
Yeah, I'm not sure, because I know that, we mentioned the cleaning staff that comes in to do those big disinfection, disinfection and cleaning opportunities. Let me check on that. I'm not exactly sure on that one. I will check, and we will add that to the frequently asked questions.
All right. And somebody had a great question about retrofitting their clinic and wanted to know if the renovation needs to be finalized by December 30th and how that could be impacted by funds.
So the grant is very specific about not prepaying for any expenses. And so the expense would need to occur within the March 1st through December 30th timeline.
And then a couple questions have come in about the timekeeping for non-clinical staff. Do they have to keep a spreadsheet showing the time that they dedicated to working with COVID? Or can they use a percentage? How should that work?
So you can use your whatever timekeeping records your clinic normally. We're not going to, designate a specific timesheet or anything like that. But it does need to be clear that it's that whatever time they're putting down is related to COVID-19. So whether it's a specific column on your timesheet or whatever, it just needs to say COVID-19 activities, and you can put hours in there. If it's an hourly employee or if it's a percentage of time that they're spending on it, that's certainly fine. It just needs to be clear, though, that is that time was spent on those activities.
So for this particular person who they allocate their time in QuickBooks, should they send a copy of the general ledger? The general journey entry along with pay stubs?
Yes, if that's what you consider your payroll records to be, then yes.
What if your clinic has to move due to COVID? Can moving be used by this grant?
We would need to discuss that actually, probably. So I don't have an answer for that right now, but we will address that in the frequently asked questions.
And just to clarify for that first report, it is from March 1st through July 31st. Is that correct?
The first monthly report, yes, which is due on August 10th, is for the time period March 1st of 2020 through July 31st of 2020.
And on the report, the total number of COVID patients, is that confirmed positive, or is that people who present with symptoms?
Cindy, can I call you onto the line to address this one if you don't mind? Or if we don't have an answer yet, we can get back, but I'd love to bring you on for that one.
Okay, I think we do have an answer. That would be those that have actually been diagnosed with COVID-19.
Thank you, Cindy.
And the next question is actually about number of patients served. And the person wants to know, is it just clinic patients, or can it also include pharmacy patients?
You want me to answer that, Allison?
I was just going to invite you on. Yep.
Okay. That would include all patients, regardless of what service they've received. You count the patient only once, regardless of what services they may have received.
And we've had a couple of questions come in about COVID-19 designated responsibilities and COVID-19 related. Do you have any guidance on that?
Well, I can share with you some of the things that we have, some examples of some COVID-19 related activities that we've heard about so far. You know, I think that your clinics know better than anybody what's related to COVID-19. And we really rely on your expertise and again, those timesheets to show that time was spent on COVID-19. So some examples could be some of the clinics are engaged in contact tracing. So they're checking in on people that may have been tested or, you know, may have been diagnosed and just, you know, making those calls to see how people are doing and, you know, getting contacts that they may have been exposed to. So some clinics are involved in that. Many of the I would say all of the clinics are doing the screening as people walk in the door. You know, those are COVID-19 related activities. Some clinics have offered up their parking lots for COVID-19 testing. And so some of their support personnel are involved in, and even some of their clinical personnel are involved in, you know, organizing that and getting those efforts off the ground. I'm trying to think of some other specific. Cindy, can you think of any other specific examples that we've talked about that fall into that COVID-19 related bucket?
Obviously it's things like testing, if you're doing COVID testing. Like Allison said, you guys know better than we do how your clinical setting has changed due to COVID-19 and what you are now requiring to be done in your clinical setting due to COVID-19. Right. So if you want to run it by us, that's fine, but you know better than we do as to what structures have changed in your facility due to the COVID-19 circumstance.
Thank you, Cindy. I think that's a great point. And it's, you know, unfortunately, we don't have a specific definition to go by when it comes to what is considered COVID-19 related. So it's really, we're relying on your expertise and your judgment in that regard.
Allison, this is Randy, if I might.
Yeah.
Governor Cooper's Emergency Order 143 opened up a viewpoint that says that when a patient is potentially a COVID-19 patient through our screening and all of that, that if they happen to have an underlying condition, diabetes, hypertension, COPD, some of the underlying conditions that are particularly affecting communities of color, the treatment then becomes COVID-19 related. And so an example might be if you identified a potential COVID-19 patient that was subject to those disparities, and you had a nutritional counselor who was providing guidance on diabetes, that would be a nexus to COVID-19 that could be established. So it's it's not everything. That's certainly not the case, but there are ways to check that out, and we would certainly invite any questions on that point as well.
Thank you, Randy.
And I just want to reemphasize, if you have non-credentialed staff and they're devoting over 50% of their time, that 100% of their salary and benefits can be counted towards the grant. Is that correct, Allison?
Yeah, thank you, Mark. That's a great point. So if you have administrative or non-clinical support staff and 50% or more of their time is dedicated to COVID-19 related activities, they all of a sudden go into that substantially dedicated bucket.
A couple more questions. Dental assistants that are clinic trained, can they count?
Dental assistants are included in those credentialed employees, yes.
And that listing is in this PowerPoint, as well as being the frequently asked questions document that we post on our website.
Yep.
Excuse me?
Yes, that is correct. It's up on the members portal.
Our client services issued healthcare cards to qualified individuals. Could that be counted in patient numbers?
Can you repeat the question, Mark?
Sure. Let's see, our client services issued healthcare cards to qualified individuals. Can that be counted in the patient numbers?
Allison, I think you're going to have to do that as a one-on-one question.
Yeah. Okay. Yeah, Mark, if you're able to find out who asked that question, let's follow up individually on that.
Yep, I got it. And then one more question, and I have a comment also for you, Allison.
Okay.
Somebody wants to know if they purchase home blood pressure monitoring devices for people with hypertension, so it would help with telehealth monitoring. Can that count?
We will follow up on that question.
Okay.
Yeah, we'll follow up on that. That's a good question.
And you may have already answered or mentioned this, but the reason we really are being somewhat conservative on expenses and things, because you all can be audited by the state, and we can too. And the last thing we want to do is have to have anybody return money. So just be careful.
Absolutely. That's a great reinforcement, Mark.
And then one last question. Let me see. I'm going to read it real quickly. I'm not real clear on this one. Administrative staff member who is defined as substantially dedicated. We could bill everything but PPP/other state grant funds for that staff member.
Right. So yes, if that staff member's salary was covered by another funding source, then they are not eligible for this to apply their staff expenses to this grant. Now, if a portion of it is not covered by another funding source, then you could apply that portion to this grant. But if it's covered by something else, you would not be able to apply this to the grant, to the grant.
All right, thank you. And if you all don't have your username and password to the members section, please email me. My email address is mark@ncafcc.org. And hopefully that might take a few emails off or out of Allison's computer since she's getting bombarded. Again, that's mark@ncafcc.org, and I can get you your username and password. Thank you.
Thank you for that, Mark. All right, we are at the top of the hour, and we certainly want to be sensitive to everybody's time and their time commitment today. We're very thankful that you guys spent the time with us today and talking through this. I'm more than happy to have conversations, following today, particularly as they relate to your opt-in, opt-out status. And certainly any, other questions that are coming up. If you're opting in, we will definitely get to those for you here very shortly. But in particular, I want to focus on those, today and tomorrow, those clinics that may have concerns with opting in and opting out, and let's have some conversations about that. So if you fall into that category, please let me know. And thank you very much, everyone. We will get frequently asked questions up tomorrow, most likely tomorrow, possibly even later today. And again, thank you for your time this afternoon. Hope everyone has a great afternoon, and we'll talk to you soon. All right, take good care.